Stark Naked Radio from Southern California, where we talk about
strategy,
butts,
goals,
blood chemistry,
lifestyle,
IV therapy,
poop,
tips,
digestion,
and
science
to help you
look better naked
and perform at your best.
Before we get started with you, Harry, the world of Instagram followers for Stark and our millions of listeners on our podcast are curious. Does Alice do Botox?
What the?
What do you think, Harry?
I'd have to give it that shine. I'd have to give that a 2 thumbs up.
Yeah. Can you flex your forehead quick for those of you watching on YouTube?
Oh my god!
Oh, okay.
Eyebrows are not your forehead.
No. Oh my god.
Okay. Well, don't answer. We'll hold up until the end to keep people hooked the whole time. Not that they won't be interested in stem cells, which is a fascinating topic. And I'd like to kind of start with getting an understanding of your story and your credentials and how you ended up here. So who are you?
Yeah, sure. So my name's Harry Adelson. I practice in Park City, Utah. So back when I was in naturopathic school at the National College of Naturopathic Medicine back in the 90s, whew, how did that happen? Holy shit.
You're an old man.
No kidding. So anyway, my whole life revolved around rock climbing at that time. I was rock climbing at a relatively high level at that time. And I was training for my dream trip to France, the birthplace of modern sport climbing. And I did this cross through move. I was working out hard in the climbing gym, and I got this pop in my shoulder. And I went and saw a surgeon, and he said, well, I can put a scope in there and cut away that cartilage, or, I can give you a steroid injection. Both of them will probably give you help in the short term, but in the long term, it'll probably cause more problems. And I thought, that's it? Those are my choices? Like that, here I was 25 years old. I was in great health. I was in naturopathic school learning about the body's ability to heal itself. And that was all conventional medicine had to offer me. So, I started asking around, and I found Rick Marinelli, who was the first naturopathic doctor to do prolotherapy. Prolotherapy is the predecessor of stem cell therapy. It's the injection of natural substances to trick your body into thinking that you've had a new injury, thereby launching your body's natural healing capacity without actually having endured any tissue insult, which, made perfect sense to me. I had it done to me. It resulted in a complete cure. My trip to France was splendid, and my life path unfolded before me. My first 6 years, I did prolotherapy. It was very, very simple. I had an office that was, slightly more complicated than an acupuncturist's office. And I thought that was it. I thought that's all I would do. And then a patient I had been treating for a number of years. Then actually, I'm sorry, let me back up. So then Mike Cronin actually introduced platelet-rich plasma to the naturopaths. This is back in 2005. So we started doing PRP, and PRP is essentially taking a patient's blood, concentrating down the platelets, injecting that. Same concept as prolotherapy, just same sheet music, different instrument, and what I found is we could achieve the results in like half as many treatments. Prolotherapy takes like 10 or 12 treatments to get where you want to go. PRP, we could do it in like 6. Then in 2010, or actually it was late 2009, a patient of mine, a woman named Laura, came to me and said, Harry, I want you to put bone marrow stem cells in my knee. And I said, Laura, I don't know how to do that. She said, well, learn. I said, Laura, do you know how much criticism I'm going to get as a naturopath if I start doing bone marrow aspirations? And she said, Harry, I'm a materials engineer for NASA, and I'm a woman. So if you want to complain to me about people telling you that you're out of your league, I'm afraid you're talking to the wrong person. And I had nothing to say. So that was late 2009. So early 2010, I learned how to aspirate bone marrow stem cells. And it worked so well that I knew that was going to be my career path from that day forward.
And so, Harry, did your that bone marrow, it's called aspiration.
Mm-hmm.
Did you at that point in time remove it from the same place as you did mine?
In the first year I was doing it, I was taking it from the tibia. Because it's much easier to get tibial bone marrow. The issue is there's very few, if any, stem cells in tibia marrow. So I did it for about a year, and then I sort of gathered the courage to learn how to do an iliac crest aspiration, which is far more technically difficult. But the flat bones in the body contain red marrow, whereas the long bones contain white marrow. Long bones are mostly fat inside the bone. Flat bones contain a lot of stem cells.
And so why is it more technical?
Well, it's the iliac crest, the ilium in your hips are like big frisbees, and you're actually aiming for the very edge. So you're not. When you do a bone marrow aspiration, like for a biopsy for cancer screening or something, they're just like plunge it right into the middle of the frisbee. Whereas with this, you're going in the edge. And the reason for that is so you can continually advance the needle while you're aspirating to continue to bring out bone marrow stem cells. Now, before I go any further, like all of my procedures are done under IV sedation. We contract with anesthesiologists who come in, just as was your experience. We put people completely to sleep. This is very painful to go through awake. There's no reason to be awake. I don't need your help. So, and this is IV sedation, not general anesthesia. So it's very gentle medications. You're breathing on your own. You wake up a little bit high. We're all done with the painful stuff, as was your experience.
Yeah, I've been asked several times, did it hurt? And of course, my answer is, I don't know. I don't think so.
Yeah.
It probably did, but I wasn't aware of it.
Yeah.
And so, but by the way, for those listening, the experience of waking up after, well, I've been under general anesthesia in the past, much more aggressive than what we did with you. And it was very similar in the experience was like lights out, don't have any recollection of what happened between the 2 hours of, whenever we started and whenever we completed, and then woke up in a different place and was wondering where the heck I was, and then gradually realized, oh, I just had this thing done. And that's kind of what the experience. So it was a very pleasant. It wasn't an experience at all. It was the
and that's sort of the point.
Which is the idea, yeah.
For what I found was happening, because in the beginning, when I first started injecting intravertebral discs specifically in 2013, I started offering sedation as an option. And in the beginning, people, it was like an add-on. You can do it awake with some laughing gas, or you can pay a little extra and go to sleep. And what I found, Todd, was that when I would speak to people at the 6-month mark, I'd call them up and I'd say, hey, this is Harry Adelson at Joe Clinics in Park City. How are you doing? And they go, oh, hello. Like obviously pissed off at me, like icicles coming over the phone. So I'd say, oh, so how are you doing? Oh, it didn't work. Oh, okay. Can you play tennis now? Yeah, actually, I'm playing tennis 4 days a week. Oh, because it says here you couldn't play tennis before. And they're like, oh, yeah, but, I started doing yoga and I'm pretty sure that's what did it. And it finally, the light bulb went off and I went, these people are mad at me because I tortured them and I probably helped them, but they won't even admit it because they're so angry with me. So then I just changed my price and I said, you don't have to be sedated, but it's included in the price. And now it's one fewer decision that they have to make. So they're actually happy. And that dynamic that I just described completely stopped happening.
Yeah, it's definitely a good call. Let's talk about the experience of, or how I felt like day one. And today is day 9-ish.
Yeah.
Like that?
Day 9.
So day one, your staff told me either from you directly or from one of your team members that it would feel like I was in a car accident. And it was exactly like that. It was exactly like joint pain everywhere. I was able to kind of shuffle around. I was told to go right from your office to bed rest. And I did. And frankly, it was kind of nice to relax and not have to worry about things. And I was sort of out of it. Day 2, I was able to get around a little bit better. And every day it got incrementally easier to move around and less pain. Interestingly, I think you warned me that my knee, you injected right around my kneecaps, which was a special request of mine because I have some tendonitis there. And you warned me that it's very painful. And that was for sure the most painful part of the post surgery experience. It was, I felt as though I could feel every part of the connective tissue anytime I bent my knee or extended my knee. But it also was the fastest to recover. don't know why.
Yeah, well, I can tell you why. It's because when I'm injecting tendons, most tendons, I don't inject directly into the tendon because it's just too painful. I never inject into Achilles tendon. I never inject into rotator cuffs. I inject around it. The patellar tendon is the one exception. And I just, I'm not even sure why that is, but I found that people can usually tolerate it. It's much less painful than like a rotator cuff is just excruciating. An Achilles is excruciating. And there's also some risk involved. There's a risk that you could actually rupture the tendon. With the patellar tendon, I do a very small volume, but I do inject directly into the tendon. So what that does is it creates a great deal of it's swelling, it's fluid, it's actual like space occupying fluid. It's not solid, it's fluid, but it's in the actual tissue. So all those nerves that are irritated to begin with are being compressed. And over a couple of days, that swelling dissipates. But it's just it is one of the few situations where no pain, no gain.
Mm-hmm. It seems as though, because this is you're sort of a pioneer in this space, that as you describe the evolution of your practice, that it's exactly that, and it's part science, part art. Do I have that right? Like there's an actual skill to this.
Yeah.
And I was wondering, when I was looking at my the injections around my knee, specifically around my kneecap, I only remember seeing one spot at the tip, but it felt like you had sort of insulted all the way around. Are you injecting in through one site and kind of moving the needle around?
That's exactly what I'm doing. I just puncture in one side and then change the direction of the needle.
Okay. And are you seeing areas of opportunity to inject?
Yeah, with your patellar tendon, so all of my injections are done either with X-ray guidance or with ultrasound guidance, with very few exceptions. And with your patellar tendon, because it's a tendon, because it's a soft tissue, it doesn't show up on X-ray. We use the ultrasound for that. So we place the ultrasound probe. We can see the needle contact the surface of the superior and inferior borders, the patella, and that's where the business is. That's where the chronic tendonitis occurs.
Okay, and so when you look at mine, does mine look all old and jacked up, or do they all sort of look the same? Or
it looked like you and I are about the same vintage. It looked like
that's a great way to put it.
That's a great way.
That's how I feel.
It's
wine-ish.
Yeah, it's you've put your body to the test over the years, and it shows. But the thing is, nowadays, any sort of degenerative changes, and I'm talking about conventional radiology, like when they write their reports, they used to say degenerative changes noticed. Well, now there's a trend moving away from that, because it's not a pathologic finding, it's a normal finding. Like I'm 54. If I don't have some wear and tear, like I must be a vampire. Like 100% of people at age 54 have some wear and tear. So
you
it's
look
no
great,
longer.
By the way, you do Botox?
My wife
no
talked
comment.
me out of it. I did for years, but my wife sort of got me all freaked. Anyway, yeah, I quit doing it.
Let's just take a step back though. Can you go into the mechanism as to why one would inject stem cells into joints? So there are many patients who are like asking the questions like, why is Todd doing that? I mean, he doesn't seem to be injured so much. So why is he taking the risk to do this?
Yeah, sure. You bet. So, most chronic pain associated with sort of aging is some form of arthritis. And arthritis just means degeneration of the joint surface. So, if we sort of back up and, like what is actually causing the pain? And the trap that we fall into is thinking that the MRI is giving us all the information. I've had countless people say, I get on the phone with them for the first time and they say, well, you've seen my MRI, so what do you think? And I say, well, actually what the MRI tells you is mostly a whole lot of nothing. It's mostly distracting information. There's very well documented scientific evidence showing that what your MRI looks like doesn't even predict whether or not you have pain to begin with. You can have somebody with horrible pain and their MRI looks perfectly normal. And similarly, you can have somebody with like no pain at all, but their MRI looks catastrophic. So what, from a regenerative medicine perspective, what we think the pain generator actually is changes in the microscopic tissue. So, and the only way you could really measure that would be if you were to do a biopsy, which is completely impractical because it would do more harm than good. But it's actual changes to the collagen matrix, to the amount of microcirculation, the stuff that exists on the microscopic level. And that is what is actually causing the pain associated with arthritis and aging. Well, one of the things that we know that stem cells do, I'm sorry, the area in research that has the best data for stem cell therapy is wound care. And the reason for that is because wound care in the research world is kind of a low-hanging fruit because it's 100% objective. You have this non-healing ulcer, you have this wound that will not heal, and you can see it, and then you perform an intervention, and either it gets better or it doesn't. And there's nothing subjective about it. It's 100% before and after photos. Well, how does a wound heal? Like the way you heal a wound, like what's happening when you have a non-healing wound is you're not laying down new blood vessels and you're not laying down new skin. And then, so if you look at the scientific literature on stem cells, you inject stem cells into a non-healing wound, you grow new blood vessels, you grow new skin. Well, arthritis really is a form of a non-healing wound. It's the same concept. It's just instead of your skin, it's the joint surface. It's irritation to the surface that's like pissed off and inflamed and not happy, and it just won't get better on its own. And that's because your own stem cells, you've like overwhelmed your own body's ability to heal itself. And so that's what stem cell therapy is. It's just the same as prolotherapy. It's exactly why it is a perfectly naturopathic principle of using the body's natural ability to heal itself.
Gotcha. So when patients are asking, like, are you actually regenerating, like, for example, collagen or tissue or cartilage? Is that essentially what's happening at the microscopic level?
Maybe. We don't know for sure. So when I get patients who are engineers, they're the most difficult because they're like, they're the ones who say, oh, it didn't work. And I say, oh, okay. Can you go up and down stairs? Yeah, I can go up and down stairs now, but it didn't work. Look, my x-ray looks exactly the same. And, this goes back to the whole thing where it's like, if you use the imaging to determine whether or not you've had success, like it's sort of a trap. The three things that I'm most interested in are the person's level of pain, how much pain they're experiencing, their activities of daily living, and their quality of life. Those three things. If I can decrease their pain, increase their activities, and improve their quality of life, I feel like I've won, right? Now, having said that, there is more and more data being released each year showing that it may actually regenerate cartilage. There's some studies that are doing like before and after x-rays in like knee arthritis, for instance, and it actually does beef up the cartilage. I don't routinely do before and afters, but I ask people to focus on those three things. How much pain are you having? Are you able to do everything you want to do? And how happy are you?
I should probably maybe explain to the listeners why this was an important thing for me to do.
Yeah.
And I think that for those in the Stark community, certainly, and those that follow me on Instagram, it doesn't look like I'm injured, but I have experienced through Stark and through naturopathic medicine the gradual decrease of chronic issues, but not all of them. And so today, the way I see any type of pain, if I'm just going for a walk and I start to feel a little bit of a pinch in my right hip, most people, I think, just accept that as getting older, and I look at that as an opportunity to try to reverse it. Mm-hmm. And so as these things have all kind of built up in my body, the things that we haven't been able to correct at Stark, like the chronic neck pain since my 20s, some periodic low back issues because of an injury in my 20s, which we can talk about in a minute, mm-hmm. And the minor arthritic joint pain that I have, the patellotendinitis, those are all things I'd like to try to minimize or completely reverse, assuming that when I'm 80, if I don't do anything today, it's going to be much worse and probably much more difficult to to treat at that point in time, assuming that there are no technological advances. So that's kind of my way of thinking, which leads me to a question for you. To what degree?
Can I just jump in? Because maybe this is a good time to just explain the evolution of full body stem cell makeover.
Yeah.
So, I started out as a prolotherapist that evolved to PRP, that evolved to stem cells. And, the basic reason for these treatments is to treat low back pain, neck pain, joint pain. It's individual sort of like aches and pains. Well, when I first learned bone marrow aspiration back in early 2010, I think I was one of like 10 people in the United States doing it. It was so new. Nobody had heard of it. So what ended up happening was my patients were one sort of demographic. It was all Wyoming cowboys. And the reason for that is because the very first adopters of bone marrow stem cells were veterinarians, large animal veterinarians. And there was a guy up there in Evanston, Wyoming, doing bone marrow stem cells on horses. And so what would happen is you'd have these guys who had these expensive workhorses, ranchers, wranglers, ex-rodeo, they have these expensive workhorses that would get too old to work. So they take him to this guy, and then suddenly they get like 2 or 3 more years of work out of him. And they could see it with their eyes. I mean, it was like totally obvious. And so they'd say, well, can't you do my low back and my neck and my hips? And the guy would say, well, no, I can't because I'm a veterinarian, but there's a guy in Park City doing it now. You should go to him. So those early years of doing it, I was doing these busted up old cowboys. I mean, and these guys had arthritis through their entire bodies. I mean, these are all like welders and oil field workers and, tough dudes who never took days off and have worked hard their entire lives. And so they would literally be riddled with arthritis. I do these huge treatments. I've never billed insurance, so I've never been like sucked into this trap of, well, we can do one knee, but if you want the other knee, you got to come back. I don't care. I'll do sure, we can do that. So I would do like their whole spine and both shoulders and both hips and both knees. And as a joke, I started calling it full body stem cell makeover, like tongue in cheek. Well, then Dave Asprey became a patient in 2016, early 2016. And I started getting his followers, and I started getting people interested in longevity and vibrant longevity and life extension, and, who most importantly want to be active right up to the bitter end. And I started getting people saying, can't you just do my whole body preventatively? And I thought, yeah, actually I can. I've been doing it for years. So that was how full body stem cell makeover came about. And at this point, about half the people I do are people like you who have, legitimate pain complaints, multiple areas. But while you're here, we may as well just do all of it. And then the other half are these sort of biohackers who don't particularly have a lot of pain, but they never want to get that way. So we just go ahead and do it preventatively.
How interesting.
Yeah.
Does the age of the patient, or let me rephrase that, does the health status of the patient have a big impact on?
The health status of the patient has a huge amount to do with it. If a person's not in good health, won't treat them because it's not going to work. It's going to be a waste of time. It's going to be a waste of their money. It's just not, it's bad for business. It just doesn't make any sense. I say no to as many people as I say yes to. We turn a lot of people away just because they're not healthy enough. Either they're not healthy enough, or if they are habitual narcotic users, I won't treat them. If they're heavy drinkers, I won't drink them. There's a lot of no's.
So what do you consider not healthy then?
Just sort of like you can sort of look at somebody. I mean, it's if somebody has out of control blood pressure, if somebody's morbidly obese, I mean, there's, it's a consolation, and it's a little bit of a slippery slope because you can actually have some fairly obese people who are actually still in pretty good health. And we do fine with them, but it's, just sort of the classic blood pressure and sleep. I mean, sleep is such a big one. People with sleep apnea, that those people, there's the impact, the health impact of sleep apnea is so profound and so widespread. Yeah. COVID's still happening. We still have dogs in
Yeah.
there.
Yeah.
So you definitely just kind of have a pretty much, when you do an initial intake or an interview, you're just kind of screening for all of these kind of comorbidities to make sure that.
I just have a very basic 1-page health questionnaire. The first question is, are you in good health? Yes or no. And then, it goes through all the normal things. And if there's a lot checked on there, then what we do, just because, I'm not an expert in internal medicine, I've been so focused on this. If there's like a maybe, then I actually have them do a consult with the anesthesia staff. And then I let the anesthesia staff determine, because it's largely about, first and foremost, is it safe for this person to go to sleep and wake up? So, I defer a lot to my anesthesia staff.
Do you still do PRP and Prolo?
No.
No, just stem cells.
Yes.
Okay. And can you kind of, the process itself is fairly complex.
Mm-hmm.
And I'm assuming that it's not, it seems like you can go to a lot of places in, for example, the state of California,
Mm-hmm.
who purport to do stem cell therapy. And I just want to get a sense of what you see as the differences between what you're doing in your clinic, because you've got so much more experience versus probably the rest of the
yeah,
world.
There's a lot of really good practitioners in California and elsewhere. There's a lot of people who know what they're doing and are doing a great job. If you are in Southern California and you've got a simple Achilles tendonitis or a rotate, if you got like a single problem, probably you should just stay local, because it's, you're going to see somebody there and it's probably going to help if they're worth their salt, right?
Mm-hmm.
What sets us apart is two things. One is our kitchen sink approach, and the other is our willingness to do these huge treatments. Okay. So people fly into us literally from all over the world. I mean, before COVID, we were 25% international. Well, even more than that if you count the Canadians. I don't really count the Canadians, but I mean, we were getting a lot of Europeans and et cetera. Because we're really the only place in the world that does full body stem cell makeover. We're the only place that will inject that many areas in a single sitting.
Mm-hmm. And why is that?
I think it's just because of the way my practice evolved. I think it would scare the shit out of most doctors. Like most doctors, when you tell them, like when I tell them what I do, they're like, what? I mean, it sounds crazy. And then you watch the video and it looks insane. But I've done it for so long, over so many years, just gradually like adding skill sets and adding stuff that it's, I don't know. We haven't really had any bad outcomes, with full body stem cell makeover. We had, out of, having done hundreds of them, we've had like 2 people who didn't feel like they got what they wanted, but nobody's gotten hurt. And you'd think at this point by now we would have had a problem if we're going to have a problem. Mm-hmm. So I think that's part of it, is because we do these huge treatments, and then also this kitchen sink approach. If I had to pick one type of stem cell, it would be bone marrow. I mean, that's, I think, the most valuable type of stem cell for musculoskeletal pain conditions. And this is something, coming up at Upgrade Labs, I put together like what they're calling a master class, and I'm bringing together 8 speakers, and we're all going to, we're each taking one type of stem cell. And my argument for bone marrow stem cells is, if you're treating musculoskeletal pain, man, it's like, it has the most research and it works. Like, it's not as sexy as umbilical cord stem cells or placental stem cells, but if like a computer is way more complicated than a hammer. But if you need to drive a nail, you want a hammer. And that's been my experience, is that those umbilical cord stem cells, if you have Parkinson's, if you have autoimmune disease, like there's all these things where and especially if you're like trying to grow a kidney in a laboratory, for instance, you want birth tissue stem cells. But for low back pain, I've just found, I've done both, because I used to commute to Bogota, Colombia for my patients who wanted culture expanded umbilical cord stem cells. And I just didn't find that it worked that much better for back pain, neck pain, joint pain. So first and foremost,
that's not legal in the United States, that particular process. Is that right?
Right. Yeah. That's why when you hear people going to Panama to get like 200 million stem cells intravenously, yeah, we can't do that here. And so like, I'll get people say, well, should I come to you or should I go to Panama? And I'll say, you should do both. Like they're completely different. They're just one, if you're doing those IVs of the massive doses, that's more of like an anti-aging treatment for your internal organs, because, IVs going primarily to your organs. It's definitely not going to your intervertebral discs. The intervertebral discs have no blood flow, and very little of it is going to your joints because there's very little blood flow in the joints. So they're just two totally different things. So bone marrow is number one. The VSEL we're very happy with, the very small embryonic-like stem cells, which is really just a form of PRP. If you look at the hierarchy of stem cells, at the top you have the embryonic stem cells, which nobody uses because it tends to turn into tumors, and it's also not legal. It's very easy to argue that it's unethical to use them. But immediately below are these very small embryonic-like stem cells. And those are cells that exist in our blood, but they're completely inactive. They're completely hibernating. Well, this guy in California, and I can't remember the name of the town, but Todd Ovokaites, he developed a laser that activates these VSELs, the very small embryonic-like stem cells. So we basically just take a PRP and photobiomodulate the PRP by activating these VSELs, and then we combine that with the bone marrow.
And prior to that, though, with me, I'm assuming you do this with everybody, you sort of optimized my blood, right? By putting me through ozone therapy, was it?
Yeah, that's right. Yeah. So we start out with that ozone dialysis. So before we even do the treatment, we put you on what actually is a dialysis machine, filters the blood, pumps it full of ozone gas, passes it through ultraviolet irradiation, and then passes it through red light therapy, which activate the mitochondria. We do that for 45 minutes. So it's basically your entire blood supply.
I love that. I mean, it came out, we do labs on me, I don't know, once a week. And so every week I'd look at my dusty old, like maroon colored blood, and I see some of our staff members coming through, and they're young, they're 25 years old, and their blood is bright red, and I'm like, oh, that just looks so much prettier. And as it was going back into me, it was looking like my young staff members, which is kind of exciting. Nice and bright, come out dark and go in bright red. What's happening there?
Yeah, so it's passing through a filter, so it's filtering out like dead cells, senescent cells, but then it's being pumped full of ozone gas, which hyper oxygenates the red blood cells.
Okay.
So,
that changes the color.
Right. In the anatomy textbooks where veins are blue and arteries are red, it's because the more oxygen in the red blood cell, the more red it is. The less oxygen, the more blue it is. So it's, we pass it through this filter where it's, a normal dialysis filter, it goes through the filter, and then you're just flushing water through that filter to replace the kidneys, essentially. Well, this, instead of water, we're pumping ozone gas in there. So we're just like absolutely filling that cell as full as possible with oxygen.
Okay. So you're optimizing my blood for use in this procedure. So now we've got stem cells from my bone marrow. We've got these little V cells from my blood.
Right now, Harry, can you go through the process in which, like, what areas are you injecting into Todd, like through the procedure?
Sure. So full body stem cell makeover is, now with Todd, we actually started with an intervertebral disc because he's got a desiccated L5S1. And that's an injury that you had when deadlifting back in your 20s. Very common weightlifting injury. There's a CrossFit exercise. I don't know the name of it, but it's where you combine deadlifting with box jumping. That exercise paid for my house. I'm serious. Like, like what knucklehead came up with that? Like, you take the king of, the most sacred of weightlifting maneuvers, a deadlift, and you like jump up and down on a box, spike your heart rate so you're about to puke, and then you try to deadlift heavy. Like, stupid. So what happens with that is, with the deadlifting specifically, when you have slightly less than perfect form, is instead of having like a nice engaged core that hinges at the waist, your back slightly bends, you lose that tonicity of your core, and then you go to lift, and the vertebral body slides one over the other. In you, it was your L5 over your sacrum. It can also be the L4 over the L5. And what happens is that shears the intervertebral disc, and it loses its hydration. It loses its moisture. And a dry disc is a painful disc. And that's another thing that sets us apart, is we're one of the few places really in the world that injects intervertebral discs with stem cells. So we started out with that, and that's not something we normally do with full body stem cell makeover. And the reason for that is because I won't do that injection preventatively, because there's some risk associated with it. For one, there's no blood flow in the disc, so the risk of infection is real. But more than that, there's some question when you poke a hole in a disc with a needle. There's some question as to whether or not that hole ever closes. And if you've got excruciating back pain, like it's worth the risk. But if you've got no disc pain, it's probably not worth the risk. So we did your L5S1 disc. That's not normally something we do a full body unless someone needs it. Then we move into sort of like the regular full body stem cell makeover, which is epidural injections, stem cell epidurals at 3 levels: the neck, sort of the upper part of your low back, and then all the way at your tailbone. So we get stem cells into like your entire spinal canal. Then we do facet injections, every level, both sides, from the base of your skull down to your sacrum, iliolumbar ligament, SI ligament, both sides. Do the occiput. A lot of people with those, tension headaches or, post whiplash headaches, that's coming from back here. Then we flip people over, both shoulders, both elbows, both wrists and thumbs, both hips, both knees, both ankles, and great toe. While I'm doing that, my partner, now you opted for the 2-hand full body, which is me and my 2 hands. We do have an option called the 4-hand, which is where my partner, Amy Killen, does the skin of the face to improve elasticity and hydration. She does the scalp to thicken the hair follicles. And then in men, she does the penis, and women, she does the vagina to optimize sexual function. In men, it's to improve microvasculature of the penis, because erectile dysfunction is a vascular condition. In women, it's to improve the elasticity and hydration of the vaginal tissue, because, postmenopausal pain with intercourse is mostly just loss of moisture and elasticity of that tissue.
And how successful is that part of that's something I didn't do. How successful is that typically?
People love it. I mean, that's routinely, people are very happy with it. I can think of very few people who did not, had no benefit at all. Nice thing about what we do is the worst thing that can happen really is, with the very few exceptions, is it just doesn't help. But we're really not in the business of making people worse.
Interesting. I've been asked several questions around, well, how long does this last?
Sure. That's a good question. So I think the best way to answer that is just looking like across my practice. I've been doing stem cells, as I said, for 12 years. And if you look at how long it takes for someone to repeat, it's anywhere from 2 to 8 years. On average, it's 4 or 5 years. So we do a treatment, and I expect to hear back from that person, usually in 4 or 5 years. So I think that's probably the best way to answer that question, is I expect about a 5-year result.
And I'm assuming that a lot of that's got to do with the overall health and lifestyle
absolutely.
of the patient as well.
And the degree of degeneration going into it. I mean, there's a lot, and it's not, it's not like 5 years, they're right back to where they were. It's 5 years later, it's just starting. And so, it could even be more than 5 years, but it's just like at the around 4 or 5 year mark, it's starting to come back, and they don't want to go back there because they've gotten used to living, with reduced pain.
I'm assuming that people that start to feel better orthopedically treat their bodies more aggressively than they afterwards, as they start feeling better, than they did when they were in pain.
Well, that's why I really try to hammer into people to take a couple months off.
Okay.
My Park City, I don't have a lot of people from Park City, and I kind of prefer it that way because, first of all, there's a lot of heavy drinkers here. And the other is like they go right back to skiing 120 days a year or whatever it is. You know, they're just like, they don't like, a critical part of this treatment helping someone is 2 months of taking it relatively easy. And by that, I just mean not pushing it too hard. Like, as I said earlier, the way this treatment works is we're tricking your body into thinking that you've undergone a new injury without actually having experienced any tissue insult. Well, if you go out and bash yourself up and do a Tough Mudder race or whatever, like now you're backsliding. Now you actually are damaging that tissue.
Didn't you actually have a patient that did that?
Yeah, Ben Greenfield. The
Yeah.
first, we've done two full body stem cells makeovers. We did one recently, and then 5 years ago we did one. And he literally, like 3 days later, did a tough. I don't know if it was a Tough Mudder or a Spartan. It was one of those.
I've been pretty sedentary, just walking basically. So again, I'm at day 9. So between day 9 and the end of 2 months, what do you think that sort of looks like for someone like me? No kite surfing, lightweight training, that sort of.
Yeah, just building back up slowly. Like, you want to move your body, because the way you heal after injury is you move around, and those collagen fibers get trained to orient in the right position. You know, that's why there's all these like horrible mouse studies where they like break their leg, and if they immobilize it for too long, like it won't heal properly. You need some movement. You know, a little bit of an immobilization in a fracture is appropriate, but if you like leave it for a very long time, then you grow this chaotic collagen fibers. That's why some of my worst cases are dentists and truck drivers. And because, dentists, they're like in a hockey league on Saturday and Sunday. So they bash themselves around all weekend. And then Monday through Friday, they're in one position all day long. Truck driver, I mean, it's not, I guess probably not so much anymore, but back, when I started, it was, you start the day by lifting something heavy, then you get and sit for 8 hours in one position, and then you end the day by lifting something heavy. And so, that's why it's so critical to take rest days. If you're an athlete, if you're a high level athlete, I mean, I started this whole journey with rock climbing, and the people who are the highest level rock climbers, the way that you get there is you put as much emphasis into resting as you do training. 2 days on, 1 day off, 2 days on, 2 days off. That was the mantra. And during those days off, you're not sitting on the couch watching TV. You're moving, but you're just not stressing your main muscle groups, which are mostly these.
So there were some things in the instructions from your office about the recovery period, like no chiropractic adjustments, I think, for 6 to 8 weeks.
Well, no aggressive chiropractic adjustments. So like it's fine to go to the chiropractor, just not the WWF stuff where they get a running start and jump.
Okay. We have a team of chiropractors at Stark, and they do FRC, which is essentially strength training for your furthest edges of range of motion. We do electromagnetic therapy to kind of heat up the tissue. They do ART.
Yeah, that's all great.
Chiropractic adjustments, all good. Okay. So I've got my first appointment after the procedure tomorrow. And it's for an hour, and it's okay to do all of those things, or should I pull out
just not that, what is it, low amplitude, high velocity, or the other way around, that stuff.
Yeah. Okay. So that sounds great.
Cool.
So that'll help with my recovery. Next week is the first week that I am supposed to be able to start training. I think I'm just going to do 4 sessions of mobility with our chiropractors, which, is probably about a 25% effort type of situation. There's no weight loads. So you're good with that?
Great. Yeah, great.
And then we'll just continue on that road.
Yeah.
All right. Exciting. Do you have any more questions for Harry?
So whenever we hear patients come in and they've said, "Oh, I've tried stem cells and it hasn't worked," and then we continue to ask them, it's like, "Okay, so were the stem cells from you, or did it come from a vial?" And they were like, "It came from a vial. Like, it definitely didn't come from me or my bone marrow." Can you just go into some detail into the differences between those two? Because I'm sure that we have a lot of people who've had that experience. So
there were so we're sort of exiting this Wild West status of stem cell therapy. Like, for the early years that I was doing it, there were so few people doing it that, like it was unheard of. Then all of a sudden it got very popular, and it got especially popular with chiropractic clinics. And there were quite a few chiropractic clinics that were like hiring nurse practitioners who may or may not have had much experience with musculoskeletal injections. And they were using labs that were producing umbilical or placental umbilical or placental stem cell vials, like you're saying. And the range of quality ranged from excellent to like dangerous. And there were a number of labs that were putting out, contaminated product, and there were lawsuits and, all sorts of things. So about a couple of years ago, the FDA sort of put a stop to most of that. They pretty much put a stop almost entirely to umbilical cord stem cells and placental stem cells. There's still some people functioning, but for the most part, that got shut down. And I'm kind of glad, because a lot of those clinics needed to be shut down. There are, still quite a few people left standing, like myself and, my friends. But the issue with those umbilical, there's two issues. One, if you ended up going to one of those clinics, is you may or may not have gotten viable stem cells. And there's really no way to know at this point. And the person doing it may or may not have known what they were doing. And that ranges from the actual injection technique to screening people appropriately. Like, if you take somebody who's in terrible health and is a smoker, but also, does extreme mountain biking or whatever, you're not going to have a good outcome with that person. And there were a lot of clinics doing procedures on people without really giving them proper instruction or even screening the people. So unfortunately, the reputation took a pretty big hit during those years, because a lot of people were treated and did not experience benefit. And my guess is that most of those people are people either who I never would have treated to begin with, or they weren't getting viable stem cells.
Gotcha. So
This is kind of a long answer.
No, thank you so much. Because we do have like a fair amount of people who've been treated in that manner, and they would just be like, no, I haven't seen a benefit to it.
Yeah.
So it's pretty interesting.
Yeah.
So,
yeah.
Well, that's all I have on my side.
Well, I think that, Harry, is there anything we didn't ask you that we should be asking you?
If people want to know more, my website's docericlinics.com. On the homepage, there's a link to a 60-minute long Nick Nanton film, a documentary film about my journey. There's also a link to my ebook, which is free to download. Okay. If people want to check it out, if they want to learn more about it, that's docericlinics.com.
We'll drop a link in the notes so people can access that easily.
Yeah. And that's a real easy book to read too. You gave me one of the copies last week, and I was able to read that within like an hour. So
thank you. I was in London speaking at that health optimization summit, and I gave it to this dinner that we had. And I was speaking to this woman, this very attractive British woman. And she said, "Oh, thank you for the book." And I said, "Oh, it's a really easy read." And she goes, "Do I look like someone who requires an easy read?" And I was like, "No, it actually is a really easy read."
No, it's awesome. It goes into pretty much a little bit more detail into the stem cells and what you do and your history and your evolution. So it's pretty awesome. Thank you so much.
Great.
Thank you, Harry. Before we wrap up, because the people want to know, do you do Botox?
No, I don't. Okay.
All right.
That was just brought up this morning, by the way. So thank you, Harry.
You guys are most welcome. Just let me know if I can do anything at all. And thank you for this opportunity.
Thank you very much. Take care. Thanks for the time.